Okay. Are we live? We're live. Hello everyone. My name is Dr. Uchenna Kole-James, pharmacist and founder of Phun on the Pharm. Thank you for joining me this evening for Fun Pharm Fridays. We are streaming live to my Facebook page, Phun on the Pharm, and my YouTube channel, Dr. Uchenna Kole-James. So thank you for joining me on this Friday evening. I'm in Michigan and it has snowed about 8 inches, and that is the reason for this wonderful background. No, I am not in the tropics yet. I am in Farmington Hills, Michigan, streaming live to you, Fun Pharm Fridays. Today we're talking about decreasing medication errors. So if you are a child of an aging parent, or maybe you're a caretaker taking care of a loved one, this episode is especially for you. And if you don't know who I am or what I stand for, I went to the University of Michigan College of Pharmacy 10 years ago, graduated with a doctorate of pharmacy, and I began working in the retail setting. I am your community pharmacist. And in my time in retail, I get asked all kinds of questions, and I compile all the information from my questions at work for Fun Pharm Friday. So I will be here with you every evening on Friday, every Friday evening at 9 o'clock streaming live. And I'm using this software called Wirecast that allows me to put these lower thirds and these beautiful backgrounds. So if you like it, love it, please comment. And if you ever have any questions and you want to hear about for Fun Pharm Fridays, go to my website, www.funonthepharm.com, or my membership site, www.friendsonthepharm.com, and ask more questions. Let me put on there. Okay, so we are streaming live. So today it's all about how to decrease medication errors. So if you follow my step-by-step recommendations, I'm going to help you have better care for your loved ones. So how do medication errors happen? Medication errors can happen by many different ways, unfortunately, and most of them are preventable. So that's what I'm going to share with you today for our Fun Pharm Fridays. So how do medication errors happen? So medication errors can happen from transcription. So that means when the doctor actually sends the prescription over. And when the doctor sends a prescription over, it can be sent over through many ways now. This is 2018. We have so much technology, and with technology, it allows us to get places faster, do better things, but also we have to double or triple check to make sure that nothing has gotten lost in transmission. So with medications could errors could happen. Let's say the doctor calls a prescription in to me at the pharmacy. If the doctor is too fast, if the doctor mistakes the patient name or the actual medication, all these can cause medication errors. And I'm going to show you that list one more time. And this is not an all-inclusive list. Medications can happen way more than what I have on this list. And if you have not subscribed to my blog, make sure you subscribe to my blog so you can get a complete list of how medication errors can happen. So when you have a diagnosis, let's say you have a loved one who maybe had to go to the hospital, they have a diagnosis. A true partnership is when the patient and the patient's caregiver with the physician can come up with a diagnosis, right? And that's the importance of having a full story. And so make sure you subscribe to my blogs, Focus on the Pharm, and I give lots of medication education for you there. But usually after you have a diagnosis, you are prescribed a medication. And after you're prescribed a medication, let's say your doctor gives you the medication, you go down to the pharmacy, drop it off, come back to pick it up, and the name that was on the medication bottle is completely different than the name that was on the prescription that you dropped off. And a lot of times this happens because of many different things. And that's what we're going to talk about today, how to decrease medication errors. So as soon as you get a prescription from the doctor's office, don't just stuff it in your pocket without taking a look at it. My job as a pharmacist is to decrease errors and also make sure your prescriptions are safe, effective, and affordable, especially with the rising cost of healthcare. But I can't do anything with the prescription after it's already gotten to the pharmacy. So there's many things that you can do before the prescription has even gotten to me. Before it even comes to me, there are many things that you can do. So when you get your prescription from the doctor's office, you gotta take a look at it. Don't just stuff it in your pocket or stuff it in your purse and trust that everything with the prescription is going to be okay. You want to make sure that your name is correct. Do you know how many times I get a prescription with someone else's name that presents to the pharmacy than what it was intended for? And that is your job, to make sure that it's your name on the prescription, to make sure that you understand what drug was prescribed for you. So you got to take a look at the medication that's on the prescription. Make sure you understand the name, both brand and generic name of the drug that was prescribed for you. It should have a quantity on there. It should also have refills if the doctor intends for you to have refills on there. Once the prescription comes to me and let's say you're like, oh no, that's not my name, or that's the wrong drug, or that's the wrong refill, sometimes I can fix those issues and sometimes I can't. So you try to make sure that the prescription is correct before you even leave the doctor's office. You got to take a look at it, my friends on the farm. You got to make sure that it's correct and intended for you. And you got to know your doctor's name. You don't know how many times I get prescriptions from patients who come in and they don't know their doctor's name. So if there's ever an issue on the prescription, I have no idea who to call for the correct medication. That's number one way to decrease medication errors. Check the prescription before you leave the doctor's office. It's so important. I'm gonna show you that list one more time of what you can do to decrease medication errors. And medication errors happen from, let's say I can't read the handwriting. If I can't read the handwriting, I'm not going to fill it. So I have to make sure that your prescriptions are safe and effective for you. So I have to call the doctor to make sure that what they intended for you is exactly what's on the prescription. You can do that before you even leave the doctor's office. Nowadays we have e-prescribing, which is electronically sending prescriptions from the doctor's office directly to the pharmacy. And this is helpful if the prescriptions are correct, because it's typewritten, there's no guesswork on my end, and everything is spelled out. So that's great, and also faxing is also great, but you have to make sure that you understand what the medication you're being prescribed is going to treat. Okay? So that's number one way to decrease medication errors. And also for medications, regular prescriptions that are not controlled, they're good for 12 months. Controlled prescriptions in the class of Control 3 through Control 5, they're good for 6 months. So if you have a prescription that was written over 6 months ago, it's basically trash. You have to turn it in before that 6-month time period, or the prescription is going to expire. And if you have any refills, you're not going to be able to get those. If it's over 6 months, or let's say you turn it in in month 5, you're not going to be able to get those. So make sure you check the date on the prescription before you leave the doctor's office, because sometimes, especially with 2018, I get a lot of prescribers who might write 2017 instead. Just make sure that you get the right date, right patient's name, right directions, okay? And medications that are Control 2, that means Class 2 medications, they're only good for 3 months. So a lot of times I have doctors who want to pre-write the prescriptions ahead of time, and they might give their patient 3 months prescriptions at a time, and the patient will come to the pharmacy with that third prescription that they were given, and it's already past the date. There's nothing I can do with that. I can't fill it. I can't change the date. You got to go back to the doctor and get a new prescription, okay? So do your part as an empowered patient and check your prescription before you leave the doctor's office. The second way that you can decrease medication errors is by having a personal medication record. And I'm going to show you a picture of that. Oh, let's see who's joined us also. And thank you for everyone who took the time out on their Friday to join me for Fun Pharm Fridays. Thank you guys. Okay. Thank you, Kashan. Thank you, Dr. Grace. Appreciate you. Thank you, Veronica. Thank you, Chinwe. Thank you guys for joining me this evening. So the second way to decrease medication errors is to have a personal medication record. And I'm going to show you a picture of that as well. So this is a complete list of all the medications that you're taking, all prescriptions, all vitamins, supplements, eye drops, inhalers, everything that you're taking on a complete and accurate list for you. And this is a portable record for you to take with you to your doctor's office. And what we do at Fun on the Farm is we keep this list updated for you. So there's never any question of what medications you're taking. And we check for drug interactions. And that's the benefit of having a personal medication record for you. Included in this list is the shape, the size of the tablets that you're taking, what they were intended for, what the prescriber prescribed them for, any special instructions, what doctor prescribed this, how often you take this. And what this does is it helps you understand exactly what these medications are for. And this helps decrease medication errors. If you want more information, make sure you click on the link below this video, put your name and email, and subscribe to my blog list, Focus on the Farm. I'm also going to send you a free handout on all the information I talked about, in addition to more information that'll help you be a more empowered patient. So that's the second way to decrease medication errors. Have a personal medication record with you to take with you to all your doctor's appointments. And make sure you check out my website, www.funonthefarm.com, and schedule your RX Power Hour today. What this is a comprehensive review of all your medications you're taking. We check for drug interactions. We make sure that everything you're taking does not interact. We create your personal medication record for you there at that time, and also come up with an action plan for you. Let's say you're a diabetic and you have a high A1C. During this process, we make sure that we're able to come up with an action plan for you to get within normal values, to get your A1C within normal values. So check out my website, www.funonthefarm.com, and make sure you schedule your RX Power Hour today, especially if you're a child of an aging parent and you're confused about your medication regimen. If you're a caregiver that you have a loved one at home and you just don't know what step to take next, and I know it can be very confusing trying to manage everything, trying to make sure they get them to the health appointments on time, because it's a partnership. It's a partnership with you, your loved one, and the physician together. So my role as a pharmacist is to make sure that your time between the physician and as an outpatient in your community at your house, that you don't have any problems with your medications that you are taking. So if you have any questions or if you're interested, make sure you schedule your RX Power Hour today. So the third way that you can decrease medication errors is to, before you get any over-the-counter medications, to make sure you ask your pharmacist. Your pharmacist is the most trained health professional as far as medication education. Our job is to make sure that your medications don't interact with each other. Did you know that if you just pick up a bottle of iron or pick up a bottle of calcium, and let's say you're taking an antibiotic like Cipro or a Z-Pak, that you have to separate 2 hours before, 2 hours after of taking any calcium or iron supplements? And this is the importance of making sure that none of your over-the-counter medications, excuse me, interact with any of the medications that you're currently taking. So if you have any questions, make sure you schedule your RX Power Hour today. Okay, my friends on the farm, 3 ways that you can decrease medication errors. Number 1, ask more questions. as soon as you get your prescription from your physician, take a look at it. Ask them questions. What is this medication for? How long do I have to take this medication? Are there any drug interactions with what I'm currently taking? Number 2, make sure you have a personal medication record with you at all times, especially if you're taking many medications. It's important to have that because that helps to decrease any kind of drug interactions. Did you know that 27% of elderly patients that have to go to the hospital, it's from a preventable drug interaction? These are adverse drug events that we can prevent if we're knowledgeable. And that's my job, to empower you to improve your health through lifestyle changes and medication management. That's my mission at Phun on the Pharm. And the third way to decrease medication errors is to check with your pharmacist before you get any over-the-counter medications, especially if you're taking many prescription medications. All drugs have effects, whether it's a good effect or bad effect. They all have side effects. So let me help you become more of an empowered patient. And that's my job. That's my mission, to serve you. So thank you for joining me on Phun Pharm Fridays. We will be here every Friday at 9 p.m. Click on the link below. Oh, also I have a free book. So I'm giving away my book for free, The 5S Habits to Start Today That'll Keep Your Ticker Ticking. So if you're interested, and I know you will be, because what this book will help you do is find habits, healthy habits, that you can incorporate in your life to improve the health of your heart. And I'm giving it away for free. So thank you guys for joining me on Phun Pharm Fridays, and I will see you next Friday. Thank you. If you have any questions, make sure you email me, go to my website. All the questions that I compile, I use for Phun Pharm Friday. So it's a topic that I have not covered yet, and you could always check my YouTube channel and subscribe if you have not subscribed. But if there's a topic that you really want to know about, send me an email, and I would love to talk to you about it, and we can come up with a segment. All right, you guys, have a good Friday. Stay warm, stay dry, and be safe out there.